Hello, I'm Dr. Srujan Dasyam, Consultant Gastroenterologist, Nulife GastroCare. Today we will briefly discuss about upper GI endoscopy or UGI endoscopy, which is one of the most widely used tools in the field of gastroenterologist across the globe. So what is an upper GI tract? In our digestive system, the upper GI tract includes food pipe, which is called esophagus, stomach as well as duodenum. And in an upper GI endoscopy, it is visualized till the proximal part or the initial part of the duodenum. In an upper GI endoscopy, the gastroenterologist uses a slender linear tube which is passed across the esophagus or food pipe into the stomach and duodenum. It can be done under local anesthesia or an intravenous sedation depending on the patient to patient scenario. When it is chosen to done under local anesthesia, usually we spray a local anesthetic spray to the throat of the patient, or when it is done under an IV sedation, we give an IV anesthetic drug which lasts its effect for next 15 to 20 minutes. Typically an upper GI endoscopy is performed in 5 minutes time, and there are both diagnostic as well as therapeutic uses for an upper GI endoscopy. When it comes to diagnosis uses or a diagnostic use in an upper GI endoscopy, usually it is performed in a patient with persistent pain abdomen or persistent vomitings, loss of appetite, weight loss, or persistent or bleeding from the GI tract, which is usually blood vomitings or loss of blood from the stools. In the diagnostic endoscopy, there is a channel through which we can take biopsy or a tissue specimen using a biopsy forceps. And in therapeutic indications, whenever the patient has bleeding or a stricture esophagus, we can pass the instruments through the channels and we can treat the ongoing bleeding or dilate the narrowed part of the lumen.